Today, we're diving deep into antihypertensives, the medications that help manage high blood pressure or hypertension. We'll explore how they work, their uses, and some common examples. Let's get started. Antihypertensives are drugs designed to lower high blood pressure. They work through various mechanisms, and today we'll break them down by type. First up, diuretics. These medications help the kidneys eliminate excess sodium and water, reducing blood volume and pressure. There are three main types: thiazide, loop, and potassium-sparing diuretics. Thiazide diuretics act on the distal convoluted tubule in the kidneys, inhibiting sodium reabsorption. Loop diuretics act on the ascending loop of Henle, inhibiting sodium, potassium, and chloride reabsorption. Potassium-sparing diuretics work on the distal convoluted tubule and collecting duct, either by antagonizing aldosterone or blocking sodium channels. Diuretics are often the first-line treatment for hypertension and are also used to manage edema in conditions like heart failure, liver cirrhosis, and renal disorders. Some common examples include hydrochlorothiazide, furosemide, and spironolactone. Next, let's talk about ACE inhibitors. These drugs inhibit the angiotensin-converting enzyme, or ACE, reducing the production of angiotensin II, a potent vasoconstrictor. By blocking angiotensin II, ACE inhibitors help relax blood vessels and reduce blood pressure. ACE inhibitors are used for hypertension, heart failure, and post-myocardial infarction to improve survival. They are particularly beneficial for patients with chronic kidney disease and diabetes. Common examples include lisinopril, enalapril, and ramipril. Now let's explore ARBs, or angiotensin II receptor blockers. These medications block angiotensin II from binding to its receptors, preventing vasoconstriction and aldosterone secretion. This action helps to relax and widen blood vessels, lowering blood pressure. ARBs are used for hypertension, especially in patients who cannot tolerate ACE inhibitors, as well as for heart failure and diabetic nephropathy. Examples include losartan, valsartan, and irbesartan. Calcium channel blockers are another important class. These drugs inhibit calcium entry into heart and arterial cells, reducing contraction strength and relaxing arteries. There are two types: dihydropyridines like amlodipine, which act primarily on vascular smooth muscle, and non-dihydropyridines like diltiazem and verapamil, which also affect the heart. These medications are used for hypertension, angina, and certain arrhythmias. Examples include amlodipine, nifedipine, diltiazem, and verapamil. Next, we have beta blockers. These drugs block beta-adrenergic receptors, reducing the effects of adrenaline, which decreases heart rate and myocardial contractility. By doing this, they lower blood pressure and reduce the workload on the heart. Beta blockers are used for hypertension, especially in patients with coexisting heart disease, angina, heart failure, arrhythmias, and post-myocardial infarction. Examples include cardioselective beta blockers like atenolol and metoprolol, and non-selective beta blockers like propranolol and nadolol. Alpha blockers are another type of antihypertensive. They inhibit alpha-1 adrenergic receptors on blood vessels, preventing vasoconstriction. This action helps blood vessels remain relaxed and open. Alpha blockers are used for hypertension and for relieving urinary symptoms in benign prostatic hyperplasia, or BPH. Examples include doxazosin, prazosin, and terazosin. Next, we have centrally acting agents. These drugs stimulate alpha-2 adrenergic receptors in the brain, reducing sympathetic outflow to the heart and blood vessels. This leads to a decrease in heart rate and blood pressure. These medications are used for hypertension, especially in resistant cases and during pregnancy. Examples include clonidine and methyl-dopa. Let's talk about vasodilators. These drugs directly relax the smooth muscle in the blood vessel walls. This action causes the blood vessels to widen, lowering blood pressure. Vasodilators are used for severe hypertension and heart failure. Examples include hydralazine and minoxidil. Finally, we have renin inhibitors. These drugs block renin, an enzyme responsible for the conversion of angiotensinogen to angiotensin 1, reducing angiotensin 2 levels. By doing this, they help to lower blood pressure. A common example is aliskiren. In many cases, a combination of these medications is used to achieve better blood pressure control. For example, a diuretic may be combined with an ACE inhibitor or a calcium channel blocker to enhance the overall effect and target different mechanisms. This approach is particularly useful in patients with resistant hypertension, where a single medication isn't sufficient to control blood pressure. While medications are crucial for many, lifestyle changes can also significantly impact blood pressure control. Reducing salt intake lowers blood pressure by decreasing fluid retention. The DASH diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy, is highly recommended. Regular physical activity strengthens the heart and improves its efficiency, helping to lower blood pressure. Losing excess weight reduces the strain on the heart, helping to lower blood pressure. Limiting alcohol intake and avoiding smoking can improve overall cardiovascular health and help control blood pressure. By combining these medications and lifestyle changes, we can effectively manage hypertension and reduce the risk of complications like heart disease and stroke. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more educational content. See you next time.